The noise will come up.
It's starting now.
So close the Zoom.
Which one? This one? Hello, LifeVantage. This is Darren Jensen coming to you live from Salt Lake City, Utah. And no, it's repeating it again. This is Darren Jensen coming to you live from Salt Lake City, Utah. And no, it's repeating it again. This is Darren Jensen coming to you. Okay, hopefully this works now. Okay, I think we've got that repeating out of it. This is Darren Jensen. I'm coming to you live from Salt Lake City, Utah. I apologize for the late start today. We've been having a few little technical issues, but now we're ready and we're going. This is one of my favorite series that we do. Today is our doctor series, and today we have one of my favorite of our doctors, Dr. Sveta Silverman. Thanks, Sveta, for being with us today. And I was just with Sveta up in Canada just yesterday, I think, is when I came back. So it was always a pleasure to be up in Canada with our great Canadian leaders. But today we're going to be talking about product. Before we do that, I just want to let everyone know that if you would like to put down your name and your city and state in the comment section. Right now, Sveta and I are doing this over Zoom, so I won't be able to see your comments, but if you want to put your comments down, then we're going to be giving away some Pet Tandem. If you want to get a free bottle of Pet Tandem or be in the drawing for it, please name city and state, and we'll get you in the drawing for it. Also, as I mentioned, today is our doctor series, and we have Dr. Sveta Silverman with us, and I just wanted to introduce her. Dr. Silverman has a doctorate of medicine from the University of Alberta, Edmonton, Alberta. She is a pediatric surgeon and is currently a surgical pathologist at Misericordia, hopefully I pronounced that right, hospital in Edmonton. She is a published author and member of the Canadian Association of Pathologists, the American Society of Clinical Pathologists, the International Association of Pathologists. She's received awards for pathology and is fluent in English, Russian, and Hebrew. And with that, I'd like to welcome Dr. Silverman with us today. Sveta, thank you for joining us.
Thank you, Darren. It is such an honor. I was so excited since Saturday.
Well, the honor's mine. Hey, Sveta, what is a surgical pathologist? I really don't know exactly what that line is.
So you see this is a case of slides, and what do I do for a living? I basically diagnose cancers. So I diagnose cancers and other stuff under the microscope. So I am, not me, but we pathologists with a guiding light for clinicians. Okay. So upon my diagnosis, the patient is going to get treatment, whether surgery, no surgery, whether chemotherapy, whether radiation therapy, or on occasion nothing. You know, sometimes I break good news, but by and large, I'm a bad news doctor, because I diagnose cancers. Yeah,
it sounds like, well, you might be a good news doctor for many, where they say, hey, there's nothing here. That would be the good news. But yeah, definitely, I can see how you deliver some really sobering results sometimes. Well, Sveta, knowing that you are says here, a pediatric surgeon and also a surgical pathologist, what does an MD impress you enough to get you here to this point? I mean, you're here as part of LifeVantage, and you've been using our products. You know the science that's behind them. What's been your driving force, or the drive behind you to get to where you're at today?
Well, you is my driving force. LifeVantage is my driving force. I just came back from Vancouver. It was an incredible conference. What drives me in LifeVantage? A, people, amazing people. B, tremendous products with incredible backed up science and the future. What we know and what we're dealing with, the rest of the world doesn't know yet. What drives me is the future of this company and exactly what you lined it up for us. You as a corporate, what I love about that corporate aspect, you guys are anticipating the trends, the technology, the future of this type of a business, of the health and wellness and network marketing business. And obviously my team is my drive because I love my team, and I also have a passion. I love LifeVantage because it's a part of my teaching to prevent, to stay healthy, to prevent diseases. We need to jump on diseases before they occur. We need to stay healthy to cure diseases.
So with that, and since we're here on our doctors one, I just wanted to say remind everyone that the statements of today have not been evaluated by the Food and Drug Administration, and our products are not intended to diagnose, treat, or cure or prevent any type of disease. But with that said, Sveta, as a pediatric surgeon and as a pathologist or surgical pathologist, what was your thoughts when you were first presented with the information about the product? What led you to not only try it, but also become involved in the company? I mean, talk to us about what influenced you from a science standpoint.
The NRF2 activation and the reduction of oxidative stress, that's what influenced me. Well, to be honest with you, what influenced me is NRF2 Protandim to begin with. When I jumped on Protandim to start taking Protandim, I did not have my background of acquired knowledge. I just knew the composition of this product, and I knew it has to be me. Because I eat right, I exercise, I pray, I try to stay healthy. I want to stay healthy. So I knew that grabbing this, I knew I needed that in my body ASAP, just to keep me where I am. I started Protandim on a healthy background. And after then, being on Protandim, I started reading, and it blew me away what this little yellow pill carries behind it in terms of science. And well, actually, we're not treating, curing, mitigating disease, but when you start reading on NRF2 activation, obviously it's going to be attached to some unhealthy things.
Yeah. Well, Sveta, with that, so you said that you were healthy and you were really trying to do things the right way. And I know that you represent a large portion of the population that's out there trying to be healthy, because, if you don't have health, I mean, you don't have much. And so with that, why is it important? And this might be a question for some people that some people have. Hey, I'm healthy. Why would I need to take the products? Why does a healthy person need to take these products?
Oh, great question. Thank you. Well, I call our product as a mandatory supplementation. You absolutely need to eat right, and you need to eat your antioxidants. But with this said, you absolutely must to produce your own. But the older we live, upon 20 years of age and up, our ability to make our own antioxidation decreases. That's the way we just build. When we age, we don't defend ourselves as good as we can. So that is why taking Protandim, rebooting my and everybody else's defense apparatus, to me is an absolutely mandatory.
So you're saying that, at about what age does our ability to fight this oxidative stress begin to decline? Did you say 20 or so?
20.
Okay. So when would you recommend, from a medical standpoint, you're a pathologist, you're out there looking, you're one of those, you're saying the bad news doctors. What would you recommend? When should people start taking the product?
20 plus, everybody.
Okay. All right.
If you want to live happy, if you want to look good, if you want to feel good, if you want to perform good, You need to take care of yourself. And that's why it's a must. You know, we live in a very toxic, unhealthy environment. Nothing we can do. I don't live in Alps, in the mountains of Georgia or something like that. I live with exhaust, electromagnetic fields, computers, environmental stress, maybe work-related stress. We all live with financial stress, so we need to take care of it. How do you take care of it? You need to optimize your ability to clean up that cellular garbage, that cellular damage. So that is why Pretandem is one of these. It is the best reboot of my cellular defense.
Where do you find, now you just named off a number of sources of oxidative stress. For most people, what is the main source? I mean, if you were to, and I don't know that there's a right answer, just by what you were saying, it just made me start to think. What are some of the largest sources out there that we may not think about?
The largest source of a cellular stress is our outside world stress. AK, most important, financial stress, job-related stress, marital stress, environmental stress in terms of pollutions, toxins, these kind of things, and obviously some unhealthy foods that we eat, like that is going to create our cellular stress. From the outside stress, everything applies to our cells. That's why we need to eat right, but most important, we need to make our antioxidants. And another important thing is our antioxidants are helping the antioxidants that we apply from foods. When you eat your vitamin C, for example, from foods, or some people supplement, your vitamin C only negate one free radical per one molecule of vitamin C. And then what happened to this vitamin C, it actually turns into free radical. And in order to make it back into antioxidant, we need the antioxidant that we make. We need glutathione, to convert vitamin C into a good guy. Well, guess, you cannot pop glutathione pills. It doesn't work. It just doesn't work. So the only thing that you have is to make your body to make glutathione. So this thing is scientifically proven to increase yours, and everybody else's ability to make this glutathione by 3 to 4-fold. Mm-hmm. And there are no supplements on the market to do that. There are no drugs on the market to do that. No glutathione, we cannot think. The liver suffers, the major organ suffers. So, that's why this is unbelievable.
All right. Now, I was giving away a pet tandem product, and I really, like the pet tandem from the standpoint of, I've seen so many people now have dogs, have pets. And if you've noticed that we've repositioned it to be pet tandem and then for dogs, because at some point it would give us the opportunity to expand it to other animals. But right now we have it for dogs. The health for dogs has turned into, I think it's a $60 billion US dollar industry right now. Why do pet owners also need to worry about oxidative stress in their pets?
Well, this is a great question. Now, you're talking to somebody who, I had a cat. She just left us. She was 18 and a half years old.
Wow, that's an old cat.
Well, she was old because she was on Pretandem for like about 4 years. The day I started taking Pretandem, my cat was given Pretandem, obviously forcefully. It's now, you mentioned before I tap into oxidative stress in animals, we have an incredible results with dogs. We know that. However, we haven't tapped into oxidative stress in horses. Mm-hmm. My team has incredible results with horses and the dogs, because if you take the lifespan of an animal, it's obviously shorter. But what I was explained by some veterinarians, which are LifeVantage distributor business builders, the dogs, for example, suffer oxidative stress. It's much faster at much higher rate. And some of the larger breeds, that oxidative stress leads to, let's say, hip dysplasias or some limb problems. And we know that there was a study done at the Prescott Veterinarian Hospital, double-blind, placebo, randomized control study. But before they evaluated the study, everybody knew who was on sugar pills and who was on Protandim. The owners knew, the handlers knew, the staff, the personnel in the hospital, they knew, because dogs don't lie. The one that they were on sugar pills, they were limping, but the ones that they were on Protandim those days, they were jumping.
Okay. When you approach people about, let's say, about using Protandim, and you notice that they might have a dog, how do you talk to people maybe about both products? I mean, kind of give us an example of how you compare those two together.
Compare.
No, not compare, but how do you, when you approach someone and you talk to them about Protandim, if you notice that they also have a dog, how do you combine those two together to talk to them so that they also know that we have something for their pets?
Well, this is a great question, because in this business, when we're successful, we are very good interviewers. We try to connect with people. Mm-hmm. We try to create that intimate connection, that relationships. So when I talk to someone and the conversation evolves and it's about family and stuff, they may bring up that they have animals, and we'll start talking about the animals, or veterinarian clinic, or how old is your dog, or I have a cat, you have a dog, so how is it going? Oh, my dog is 9 years old, my dog is limping. Well, guess what? I actually have something for you that may help your dog. Not pushy, just, approaching, helping. And you know what? Animal lovers, we take care of our animals on very frequent occasion much better than we take care of ourselves.
I've noticed that.
We're willing to spend the money on them. We're not willing to spend the money on us.
It's like my kids, they found a stray cat, and that stray cat came around our house, and at some point, so this is a free cat that just came around, and somehow a dog injured the cat. And they're like, Dad, you got to take the cat to the vet. And I'm like, look, I love animals, but I'm like, oh, okay, free cat, and you end up spending $1,000 or $1,500 on a stray cat. So I agree with what you're saying, that people spend a lot of money on their pets. They're members of the family. Do the ingredients of the Protandim and the Protandim differ at all? And if so, how would you say?
Well, I believe, see, the thing is, we don't have Protandim in Canada. We have, as far as I know, the basic combination of Protandim, the 5 ingredients is identical to NRF2 Protandim. But why Protandim is amazing, because it also has fatty acids. Mm-hmm. It also has obviously flavoring to attract the animal, and it also has a collagen. But the source, you can put the collagen from some synthetic source and stuff, not from the avian bones and stuff. This is what amazes me about the LifeVantage is the quality of ingredients. And again, the animals don't lie. They don't like it, they won't take it. But dogs love Protandim. I call it doggy biscuits. They love it, they eat it. It's like a treat. For many, many dogs, it's a treat.
I've never tasted it. Sometimes we taste and test all the products. What is it, like bacon flavored or something? And I'm sure I'll have to see what type of flavoring we put into that.
Ask Dr. Mark Gordon. He tasted one of them.
All right. What about Protandim? Do you know of any tests that have been done, or what the science is behind it?
Well, as far as I know, there are no tests on Pitandam formulation, but as I told you, there was a double-blind placebo randomized control study from the Prescott Veterinarian Hospital. And it's published study and stuff. Now, the thing is, Dr. Kangas, Katie Kangas, she published a study on oxidative stress in animals. We are so lucky. Let's say I'm a part of LifeVantage. Outside of LifeVantage, we have like doctors LifeVantage, so we can chat and stuff. Every Elite Academy or Global Academy, we exchange, and we have our sort of mini meetings. We have a lot of veterinarians. We have Dr. Lee Seward, a creator of HeartGuard. We have veterinarians with tremendous scientific credentials and background. So, if they're doing this, there is something behind it. Now, just as a lame person, not as a doctor, and on my team, we have stories about dogs, how we improve their health and life, putting them on Protandim, which is actually validated by their blood work. That's what is amazing. And the veterinarians can put one and two together. What happened? What happened to your dog? Why is the blood work normal being in a renal failure before?
So, you were mentioned before that some of your group and others have had great results on horses. You mentioned you had it on your cat. And, I really see Pet Tandem as a line that in years to come that will continue to develop, because I get a lot of requests for horses. I mean, a lot. And so
I think it's a tremendous part of our LifeVantage legacy. Let's say equine industry is huge. It's huge on supplements, and it's somewhat kind of opinionated industry with we haven't integrated there yet. Mm-hmm. Do I have not me, a very close friend of mine and a leader, you've met Danny Stevenson, who's got a tremendous result on horse with laminitis, and not much works other than Protandim works. And it is so easy. Horses don't need Protandim. Horses need Protandim. Dogs need Protandim. If you guys come up with a formulation for the cats, because it's very hard to give a cat Protandim. Because he or she, they don't like it.
I would imagine we'll have to come up with something that they like. Well, moving back to Protandim now, moving back to the human side of it, what I don't hear a lot about is, I've always been impressed by what attracted me to the company. One of them was just the scientific information that's out there about our product line. And one that I was, one of the studies that I'm most proud about is the one that was done by the National Institute of Aging. And I really don't hear as much about that, but I know it was a powerful study.
It's an incredible study. I think that NIA, first of all, the validity of the study. Who did sponsor the study? Not LifeVantage. National Institute of Aging. National Institute of Aging, to my mind, can choose any supplement they want, can choose any drug they want. So for some reason, they chose my supplement, A. B, obviously, this is an independent study.
Well, just one thing on that, Sveta. They explain why. If you go in and read, and I can't even state it because then I'd be breaking the thing about making medical claims, but at the beginning of the study, I don't know, a few paragraphs down, they explain why they chose Protandim and the scientific evidence behind it. And boy, I read that and I'm like, whoa.
You're totally right. But the thing is, they chose the drugs and they chose some other very, very potent and amazing supplements. And it was not a one institutional study. It was multi-continental study. There were institutes from Europe. There was an university from Australia, America, United States of America. This was a multi-year study. So the validity of the study to me is, and then this is statistically proven study. That what sort of makes me. It's statistically proven results. Mm-hmm. And to have my supplement as the only one amongst all the supplements and basically all the drugs other than hormone replacement therapy, estradiol. And I'm sure all the males are going to be very, very happy to take female hormones to extend their lifespan. So to me, basically, there is only thing that is applicable to males and females, to men and women, is Protandim. It's unbelievable. Yeah. To have 7% statistically proven increase of lifespan, how critical it is. This is an amazing study. And to have 26 peer-reviewed studies behind us, this is a validation. Show me another supplement with that kind of a validation. Nutraceutical.
Yeah. Well, Sveta, we're running short on time now. And I know that whenever I'm with you, you are very passionate. You're a passionate person, passionate about the products. What if, the people that are watching this, what are some of the, just to kind of tell us what maybe some of the most important things that you would want everybody to know about LifeVantage. It can be about product, it can be about whatever. I'll leave it up to you. But what are a few of the things that you would want everyone to know? Because a lot of them need enough information to make a decision. What would you tell them?
Well, you stumble upon once in a lifetime opportunity. It's a tremendous company with integrity, with ethics. B, we're publicly traded. We're NASDAQ. We can't lie. We're audited. See, we have the products that nobody else has. And these products accomplish at least two of the most important aspects of health. It reduces cellular stress and cellular damage. B, it gives us a chance for energy, mitochondrial boost. It's my energy, it's my defense, it's my functionality. C, we have a tremendous compensation plan. D, we have the trends. The trend is into health and wellness. And the most important thing is people. We have the most amazing people, on both sides of the fence, in corporate and in the field of distributorship. And I love customers. I want a lot of customers because of the products. My products validate the customers, or vice versa. Customers taking my products validate my products and what I do. LifeVantage to me, it's a path to health. One of the cornerstones of health.
Well said, Sveta. Well, thank you for joining us, Dr. Silverman. It's a pleasure to see you. It was a pleasure to see you over the weekend. And thank you for taking the time out of your busy schedule to be with us.
Thank you so much. Thank you for this honor. Thank you.
Oh, my pleasure. And again, just to everybody who's watching us, remember in the comments section to go in and put your name, your city and state, and you'll be in the drawing for some of our pet tandem products that we discussed today. Also, we want to give a shout out to all of our team members, where we have a lot of them down in the Florida area. You guys just got hit by a big hurricane. I know it came up the West Coast. Got a lot of our leadership along that West Coast there of Florida. Know that you're in our thoughts and our prayers, as well as all those that were that are in Houston. I think having two hurricanes so closely together, that terrible tragedy, you don't see as much on TV. So our thoughts and prayers are with you also, as well as. I was up with you, Sveta, up in Vancouver, and I mean, everywhere in the Western United States and it seems like Western Canada, it's just full of smoke. I mean, everything's on fire. And so our hearts and thoughts go out to all of you that are in the West too. So, with that, we're glad that you could join us today. And tomorrow we continue on with our movers and shakers, and I'll be talking to Melissa. Hopefully I'm pronouncing it right, Boschman. And so that will start at 1:15 p.m. Mountain Time. So until then, thank you for joining us. Again, thank you, Dr. Silverman.
Thank you so much. Grateful. Thank you.
All right, everyone. Have a good day. We'll talk to you tomorrow. Bye.
Great. Bye-bye.